stem cell therapy for erectile dysfunction. Is it hope or is it hype? It's a huge question, right? Well, today we're going to dive right into a recent scientific review to see what the actual science says about this really promising but, let's be honest, pretty complex new frontier in medicine. First off, let's just get a sense of how big of a deal this is. I mean, erectile dysfunction, or ED, isn't some rare thing. Not at all. A major study found that it affects a staggering 52% of men between 40 and 70. Yeah, more than half. So you can see why the search for a real long-term fix is so important. And, that really gets to the core problem with the treatments we have right now. Sure, we've got drugs like PDE5 inhibitors, you've probably heard of them, Viagra, Cialis, that kind of thing. And look, they can be a huge help for a lot of guys. But here's the catch. They only manage the symptoms. They don't actually fix the underlying damage. And that's created this massive search for something that could, a therapy that could actually restore function and fix the problem at its source. Okay, so here's what we're going to cover. First, we'll look at just how widespread this problem is. Then we'll get into the promise of stem cells and the theory behind how they might work. After that, it's a bit of a reality check, what the human trials are actually showing. And we'll wrap up by looking at where experts think this is all going. All right, so let's jump into section 1. On paper, the definition of ED is pretty straightforward, right? It's the inability to get and keep an erection that's firm enough for sex. But the real story, the roots of the problem, well, they go a lot deeper. See, ED is rarely just its own thing. It's often tied to other health problems. We're talking about things like heart disease, obesity, high blood pressure, and diabetes is a really big one. The research points out that men with diabetes are 2 to 3 times more likely to have ED. And what that tells us is that ED is often a warning sign for bigger issues with your blood vessels and nerves. Okay, let's get to the interesting part. Section 2. How do stem cells fit into all this? Well, this is where things get really different. We're not talking about a temporary fix to improve blood flow anymore. The whole idea behind stem cell therapy is to do something totally new, to actually regenerate and repair the damaged tissue that's causing the problem to begin with. It's a completely different approach. So, quick primer. What are stem cells anyway? The easiest way to think about them is like the body's blank slate. It's raw materials. They're undifferentiated, which is just a fancy way of saying they haven't decided what they want to be when they grow up. They're not a skin cell or a muscle cell yet. And that is what gives them this incredible power to potentially become whatever the body needs for repairs. Now, there are 2 main flavors of stem cells. You've got embryonic stem cells, which are super powerful, no doubt, but they come with a whole host of ethical issues, plus a real risk of forming tumors. And because of that, pretty much all the clinical research for ED has zeroed in on the other type, adult stem cells. These are the ones you can get from a person's own fat or bone marrow, and they sidestep a lot of those safety and ethical landmines. All right, section 3, this is the big how. How in the world could injecting stem cells actually fix this? Well, the main idea that scientists are working with is something they call the construction foreman effect, and it's pretty cool. But hey, before we get into that foreman idea, there's one quick thing you need to know: where these cells come from. In the studies we're about to look at, the cells are either autologous, which just means they came from the patient's own body, or they're allogeneic, meaning they came from a donor, like an umbilical cord. Just keep that distinction in mind because it's going to matter when we look at the results. Okay, so here it is, the heart of the theory. What's really surprising is that the main idea isn't that the stem cells turn into new tissue themselves. Nope. It's something called paracrine effects. Basically, the injected stem cells act like that construction foreman. They don't swing the hammer or lay the bricks. Instead, they just show up on the job site and start shouting orders. They release all these signaling molecules that tell the body's own repair crews to wake up and get to work. So if you break it down, it looks like this. Step 1, the cells get injected right where they're needed. Step 2, they immediately start sending out signals, this potent mix of growth factors. And then step 3, those signals tell the local tissue to start healing itself, calm down inflammation, grow new blood vessels, and protect the nerves. So the key takeaway here is simple. It's all about signaling, not replacing. So, that's the theory. It sounds pretty amazing, right? But how does it actually play out in the real world? Well, now it's time for a little reality check. Let's look at what the human clinical trials have to say. Okay, so when we look at the trials that use donor cells, those allogeneic ones, a pattern starts to emerge. We see some really promising signs, but there are always these big limitations. Like one study showed great improvement at 6 months, but by the 1-year mark, those effects were fading. Another one helped with blood flow, which is great, but it was a tiny study of only 8 people, and they all still needed their ED pills. You see the theme, right? There's definitely something happening, but it's not a lasting, standalone cure. Not yet. And you know what? It's a pretty similar story when they use the patient's own cells. Taking cells from bone marrow showed some benefits, but getting them is invasive, it's expensive, and again, the effects tended to fade after a year. Using fat tissue is a lot easier, but the results just show how complicated this all is. One study, for instance, found it helped some men who'd had prostate surgery, but it did nothing for others. So the big takeaway seems to be that the type of patient and their specific underlying problem really, really matters. So, if you had to boil all this evidence down to one sentence, well, a quote from the scientific review we're looking at just says it perfectly. The data are far from conclusive. That's really it. We're seeing some glimmers of hope, for sure, but we are just not at the point where this is a proven, reliable treatment.
And that brings us to our last section. With all these mixed results, you have to ask, so what's next? Where do we go from here? What do scientists need to do to take this from just potential to an actual working therapy?
Let's just cut to the chase and ask the big question. Based on everything we've just talked about, is stem cell therapy the miracle cure that you might see advertised online? Well, according to the science, the answer is a very clear, not yet. So what needs to happen? The review basically lays out a to-do list for researchers. First and foremost, they need bigger, better trials. I'm talking large-scale, randomized trials with a placebo group, the gold standard, to prove this stuff actually works. They also need to figure out the fundamentals, like what's the right dose, what's the best way to deliver the cells, and, maybe the real game changer won't be stem cells by themselves, but mixing them with other treatments like shockwave therapy to get a much more powerful effect. But there is one really important piece of good news in all of this. Across all the trials that have been published so far, the procedure seems to be incredibly safe. The only side effects people really reported were things like minor, temporary pain or a little irritation where they got the injection. That's it. No serious problems have been found. So let's end with this final thought. While it's super clear that stem cell therapy isn't a proven cure today, the research is definitely fascinating. It really marks a huge shift in thinking, moving away from just managing symptoms to actually trying to restore natural function. The data might be inconclusive right now, but it leaves us with this really powerful question. Could regenerative medicine one day actually offer a true cure for erectile dysfunction? Well, the answer to that is still being written.